Cape Cod Broadcasting weaves the listening environments of 99.9 WQRC, Ocean 104.7, WFCC Classical 107.5, Cape Country 104, and CapeCon.com's website experience to reflect the lifestyles of the people who live, work, and play on Cape Cod. We hope that you enjoy this podcast.
I'm Laura Reckford, and this is Sunday Journal. We're talking about the third annual Behavioral Health Summit called Building Bridges to Recovery, which is taking place Friday, October 2nd. I'm here with Cheryl Bartlett, former State Health Commissioner, who now serves as Executive Director of the Cape Cod Regional Substance Abuse Prevention Initiative. Have I got that right, Cheryl?
Yes.
And thank you so much for being here again today. She's with Cape Cod Healthcare. And we also have Pat Durgin, Program Manager for the Partial Hospital Program for Cape Cod Healthcare and one of the organizers of the summit. Welcome, Pat.
Thank you.
Thank you for being here with us today. And we also have Barnstable Police Officer Jeanne Challis, who serves on the department's Community Impact Unit, which deals with the homeless population in Hyannis, really on the front lines of this issue. Jeanne, welcome to the show.
Thank you.
Thank you for being here. And let's start by explaining what the Behavioral Health Summit is. Pat, I don't know if you want to take that one.
Sure. I've been around for all three summits and organizer is in all of those, and also one of the early members of the coalition. And during this third summit, we really wanted to highlight the things that we've accomplished here in the community so that everyone out there knows that we actually have some very positive outcomes from the work that we've been doing and moving forward together as opposed to as in individual agencies and organizations working on shared challenges. And I think that we've really come a long way, and I think people are going to hear about that on Friday.
And the theme this year has to do with recovery, and we were talking a little bit before the show about this. Maybe you can explain what that means when we talk about recovery in this context, Pat.
Well, recovery happens differently for each person, and we have people who suffer from a mental health diagnosis and also people who suffer from addiction. And one of the challenges we face here on the Cape right now is that we have people who are challenged by both of those problems, and that often leads to poverty, to an inability to function, and it becomes, therefore, a community problem, not just a health problem. And recovery is part of a community process because it affects everyone from the businesses to the healthcare organizations to the police. And I think that we want to look at recovery as really a process and a journey that the community is on, not so much the individual, and how we've been working to get there.
And Cheryl, you have now been almost a year in your new job looking really closely at substance abuse prevention on the Cape and in this region, and probably starting to really get your arms around the issue. What are you going to bring to the conference? What will be your message?
Well, I'll be facilitating the afternoon panel, and the afternoon panel is talking about the integration of care. And it's really thinking about the whole person. We now segment care by body parts or disease, and particularly mental health and substance use disorders aren't really even dealt with within the primary care practice. That's left to be done somewhere else, and really models of care and healthcare reform have talked about integrating mental health, substance use into the primary care office. And so we're going to have some models of promise that we share with people that are out there innovating and trying to figure out how do we take care of the person holistically. So we'll have Gosnold is in some different practices, pediatric practices, primary care, OBGYN practices, where you can screen the individuals and get a brief intervention right there in that clinical setting. So we're really trying to find places where we have people and we can identify them early, as we do with other chronic diseases. We do screenings, early intervention, and treatment, and that gives us the best outcomes.
This is such a big issue, a hot button issue, if you will, right now on Cape Cod, particularly this summer, Cheryl. But as you and I have talked about before, not a new issue, not unique to Cape Cod. But is there anything in particular going on here that's different on this issue? Are there more? Are we seeing more addiction? Are the drugs affecting people more? Has it gotten worse?
I would say it's comparable to other parts of the state if you look at the data. I think what's happened, and I think this is not unique just to the Cape, but also to Western Mass. The further out you are from the epicenter of Boston and the State House and in an urban area, the less resources that we get out to be able to have an impact on these issues. So I think what's different is we're working more closely together. There's more collaboration. Things like the Behavioral Health Coalition brings providers together, and we share our lessons learned and our promising best practices. And that way I think we can all sort of move down this path of intervention together and have the greatest collective impact.
And Jeanne, as we've talked about, you're really on the front lines of this issue. You know the people personally who are living out in the camps in Hyannis, who are the homeless people on the streets that we hear about, that people are talking about. We recently saw a video for those of us at the town council meeting recently here in Barnstable, the chief of police showing young people shooting up drugs on the village green. This is a big problem, something people are really concerned about. What do you see out there in your experience? How big is this issue? Is there a way that we can get our arms around it?
Well, the substance use issue has definitely been on the rise. The opiate problem is huge at this moment. But there's also a large increase in the number of people that are presenting with mental health problems, and that's, across the board, not just with the homeless and street community. That's, every call that we go on. So we're definitely seeing an increase in the number of people that are struggling with mental health problems, and when you combine it with the substance abuse issues, it really presents a complex problem for, a patrol officer responding to a scene on how to best handle that. Is that an appropriate situation for an arrest? Is that a situation where somebody needs to, go to the hospital? Is that something where treatment is the best option? Where's the family? So you really have to look at a multitude of options for the person every call you go on.
You've gotten to know some of these people, and some of them, they may want to get into recovery. They don't really know the steps to do that. There are going to be all kinds of challenges. How do you help them when they say to you, I want to go that route?
Since we do know a lot of the people, you can sort of make an assessment on someone's level of commitment to that kind of a statement. But for the people that are serious about it, we do try to make a connection with somebody that can refer them to a program. We have the benefit right now of having the services of a behavioral health clinician that works with us 19 hours a week, and she's been a phenomenal resource for us. So we have people available, and we ourselves can make referrals to detox programs if that's appropriate. A lot of times what happens is it's late in the day or evening, and there just aren't any beds available. So we do try to make sure that somebody has a safe place for the night and then reconnect with them in the morning. A lot of times it doesn't happen. Somebody may say that in that moment, and then they're off chasing their next high, and we don't see them again for a period of a few days. Sometimes they do it as a way to avoid an arrest. And sometimes we can't avoid arresting them, and they may get their treatment through the House of Correction and a program beyond that. So we do try to make the referral when it's appropriate, though.
Maybe the bigger problem that you might see out there are the people who they're not at that stage yet to go into recovery. That's probably the majority.
It is. There's a lot of people out there who just aren't ready for whatever reason to accept the help. They may have... They may not know what's out there. They may never have had periods of clean time or sobriety. They may be fearful of it. There's a number of reasons why people don't access the services. So I think trying to establish a rapport with those people and give them the time they need, make sure they're safe, is really the best gift we can give them. But it does present a problem because you can't allow them to be out there when they're committing crimes. And a lot of times they're preying on each other. So it's a really difficult balance to maintain.
It was just a couple weeks ago when as reporters, we wrote about that you tried to clear out a section of the woods, and then it wasn't maybe a week later that they were back in there.
that's true. It was a couple of days, actually. But that site has been cleaned out, and that was really just a plea to those people to please remove the items or face the consequences. And they were great about it. They did it. Unfortunately, the area that we removed several needles from was once again littered with needles, and that's an ongoing problem. But there's a number of people that live out there for a variety of reasons, and all we can do is suggest that they access the services available and try to steer them towards what's out there. Some people are banned from the shelter. Some people don't want to go to the shelter for a number of reasons, and you can only hope that before the winter comes that people will make some better choices.
Would you say the need for recovery is a common denominator out there, or a high percentage of the people?
I would say recovery is a large piece of it, but also access to services to address some underlying mental health issues that probably haven't ever been addressed.
And that brings us back to the conference. Pat, maybe you could talk more specifically about what will be happening at some of the panels at the conference.
Sure. I'd be happy to do that. First, we have Senator Jennifer Flanagan, who's going to be talking about some of the issues that are before the Senate regarding what's going on with people with disabilities, which include, of course, people with substance use and mental health issues. As you know, funding and resources have been a longstanding problem, and we were certainly happy to hear that Cheryl was coming, hoping that she would bring with her some resources, much-needed resources. But as the coalition kind of got together, and one of the things we want to bring to people's awareness this week coming is that we have resources here. We just haven't found the best way to work together, and I think there are some resources that we want people to hear about that they aren't aware. For example, I will be facilitating a panel with people who have the lived experience of substance use and mental illness and their families, and they're going to be talking about the kinds of programming they're going to be presenting. They offer people free of charge. And I think that there's this gap in communication that I think the coalition is hoping to eliminate. We're also going to be hearing from two gentlemen who have made a film about their journey into recovery. And they've also been providing some services now. So it's very exciting to see people who have come through the dark and are here and helping others. And there's a lot of people out there willing to do that kind of work. And we just have to kind of understand where those resources are, gather them together, and find a way to give people access. Of course, Gosnold has been a leader in providing services here on the Cape, and again, they're doing some incredible things, and we'll be hearing about that. And I think one of the most exciting things that I've been part of this year is really the work with the Barnesville Police and with the police in other towns, where there's this shared kind of compassion that we never even thought about accessing before. All of a sudden, we're all kind of saying, how can we help these folks, as opposed to, other alternatives. So that, for me, is one of the most exciting parts of what's happened in the last year.
And Cheryl, in the last couple minutes that we have here, where you've been really traveling around the region over the past year and talking to different people, there are a lot of people trying to help with the issue. I know some people say that people need to work together more, as Pat said. What message would you give to people about these different service organizations and how people can work together on this issue?
So I have been meeting with lots of individuals and trying to sort of put a big net around us all and bring us together. And I think that through the county's Regional Substance Abuse Council, we have the ability to come together and learn from one another and go off and work in specific activities and interventions across the region. So I do see more and more people coming to the same table. And for instance, we're putting together an initiative for schools, trying to get evidence-based curriculum in schools. And when I first got here, there were probably 10 different organizations knocking on the doors of the schools whose main job is to educate our youth. But because youth are captive there, everyone that wants to help youth goes to the school, and that makes it complicated and a lot of work for them to try to figure out sort of who's on first and which program is best. So we've formed a prevention work group out of the county, and we're working together to put a package of toolkits together that they can select from, and they can then implement it, and they don't have 10 different people that they're working with, that we're coming together as a region. And so I think it's exciting that we are working together. And I think the other important thing that we've done this year is try to put a face of recovery out there, that most of the stories in the media are about another tragedy, another death, another overdose. And I think people feel hopeless and helpless, that there's nothing that can be done. And so often people will say to me, how could you even think about doing that job? There's no hope, or you can't do anything about it. And I don't believe that to be true. And showing these faces of recovery and people talking about recovery. I was at the State House on Monday with 500 people and people shouting out decades worth of recovery. So recovery is all around us, and we've stigmatized this disease so much that people don't often share that. And that's a message of hope that I hope we continue to promote across the Cape.
The other message I've been hearing a lot this year from particularly the governor and his task force in the last minute or so, maybe, Cheryl, you could talk to this idea of education and prevention. You touched on that, people going to the schools, that we're really seeing a new emphasis on getting to people before they are addicted.
Exactly. I think that we are seeing the fastest rising age group of people using heroin is 18 to 25-year-olds. So we need to get into our elementary and middle schools with age-appropriate, evidence-based education so that we can teach these kids that these drugs are dangerous. If you read some of the statistics out there, kids don't think that opiate medication that's in the prescription form is dangerous to them. It's in their parents' medicine cabinet. I was reading a statistic, I think just this morning, that 59% of kids in middle school don't think that they're dangerous. So that has to change, because an opiate really is a legal heroin.
A lot of big issues here. We've really only touched on them, but unfortunately, we're out of time. I've been talking to Cheryl Bartlett, Jeanne Challis, and Pat Durgin about the upcoming Behavioral Health Summit and issues having to do with addiction and recovery. Thank you all for being with me here today.
Thank you.
Thank you.
I'm Laura Reckford, and this is Sunday Journal.
Cape Cod Broadcasting weaves the listening environments of 99.9 WQRC, Ocean 104.7, WFCC Classical 107.5, Cape Country 104, and CapeCod.com's website experience to reflect the lifestyles of the people who live, work, and play on Cape Cod. We hope that you enjoy this podcast.